some of the younger people, they heal really, really fast. We have a lot of families that come in car accidents and their kids are in the car with them and they have, 25% less or 50% less pain than their parents.
All right. Welcome, everybody, to the D4A Personal Injury Show. I'm your host, Jean-Paul Anderson, and today I have a special guest, Dr. Victor Rafa from Gateway Rehab, Rehabilitation and Wellness Centers. He's located in Mission Viejo, California. Doctor, would you like to introduce yourself?
Thank you, JPA. Hey, Dr. Victor Rafa here. Like you said, Gateway Rehab and Wellness Center. We're in Mission Viejo, California. We've been in practice for a little over 20 years now. And over the past, couple of decades, we've had some changes and we've grown our practice. So now it's not just, chiropractic. It's a multitude of services we offer, from medical to physical therapy, acupuncture, chiropractic, all that fun stuff. And we're happy to be here and let you know what we do here.
Wonderful, wonderful. And of course, as you know, the show is about, personal injury and car accidents and all the stuff that happens to someone unexpectedly and has to go through all the trauma and everything. It's almost life-changing when you get into a car accident or really any type of injury, especially when you're getting older, right? It just takes more time to, get better and stuff like that. So wanted to ask you a couple of questions some of our listeners had for a chiropractor. And one of them is, how do you approach patient education to help a patient understand what type of treatment they will need when they're involved in a personal injury accident?
You kind of hit it right on the nail on the head. Things change. As we get older, our bodies take, unfortunately, more time to heal. You can look at, some people that are watching this might understand our skin gets thinner as we get older and it ruptures more easily. When you're in an accident, you got some big forces that are at play there. And it's not like somebody just takes their fist and hits you in one spot of your body. It's a jolt that goes through your entire system. So you have a ton of micro trauma. And with that trauma, you get a lot of little scar adhesions that start building up. Once somebody understands that, they can kind of understand why they have so much pain, not just in one area. And it makes them feel really tired, lethargic, because it takes a lot of energy to heal the body. We are really focusing on helping them get that scar tissue as the body's healing under proper control so that it doesn't have an effect on them, not just right now, but 5 years from now, 10 years from now. And this is even more true for some of the younger people. They heal really, really fast. We have a lot of families that come in car accidents and their kids are in the car with them and they have, 25% less or 50% less pain than their parents. Mm-hmm. And they heal really quick. But what they need to understand is, sometimes you have to heal that scar tissue and your body heals in a set parameter. It takes, a minimum of 4, 6, 7 times 8 weeks to truly heal scar tissue. And if you don't take care of it now, they end up having problems later on. So if we can get the people to understand that can really help them in the future.
Yes. Yeah. It's crazy as I'm getting older and I see my friends, like a friend of mine, he had a stiff neck a couple of weeks ago and I recommended him to, a few different chiropractors in the area. And he ended up actually going to one, which he's like totally like kind of against like doctors and going to like doctor visits,
Yeah.
But he went and the doctor, I believe did, some kind of techniques on him and they just realigned his spine and all this stuff and adjusted him, I believe. And I remember the first 2-3 days, he was like, I'm feeling weak. I feel lethargic. I feel tired. I told him to ask the doctor. I'm like, what can he do? And so the doctor had said that it takes time for the body to heal, right? But on the 3rd or 4th day, he seemed, when I saw him again, he seemed like a 19-year-old, just feeling great and happy. And he had this glow on his face. I mean, completely different person from what I saw before, this adjustment. Do you have any case studies that maybe recently have had a kind of almost like a miracle outcome?
Yeah, there's actually, I wish I can say it happens every day, right? But you get these ones that just stick in your mind over the years. That's actually a question a lot of people ask. It's interesting. But, for me, there's two that really come to mind. One, it's been a while. It was this older gentleman and he had grandkids, and he just wanted to be able to hang out with his grandkids and do stuff with them. And when he came in, he was in a lot of pain. It was low back. He had pain that was radiating down his leg. He had been doing other care previously to come in with us. He had done epidural injections. He'd done physical therapy by itself for about 3 months. And when we talked to him, we looked at the x-rays. He had MRIs already. He had a true compression happening where the disc was just compressed down. And we explained the impact of that. And we put him on a true program where we did decompression along with some physical therapy, some chiropractic. And his goal, like I said, was just to be able to hang out with his grandkids. What blew us away is after his care, he went to Disneyland for the first time in probably 20 years with his grandkids, stood in lines, walked around Disneyland, went on roller coasters. And then he came back. That was like, he had shared that with the entire office. That was awesome.
That is definitely.
And the other one that for me that really always hits home is my mom. She's now retired, and it's been about 7 years now. She had chronic knee and low back pain. When she retired, they bought a beautiful fifth wheel RV. Her and her husband were going to travel the United States and enjoy.
Nice.
3 months into it, she gave us a call and said they were coming home because her knee and back was hurting so bad she couldn't get in and out of the trailer, and she couldn't do the hikes and enjoy all this stuff that she worked so hard for. She came back. We had a heart to heart, and we did the decompression part. We also did stem cell in this particular case for her knee. And I'll never forget this. I was actually doing something just like this. I was doing a talk about knee pain of all things.
Oh, the worst.
I got a text from my mom with a picture of her out on a trail in Utah. And she's like, this changed my life. And I was able to do stuff. She's out traveling. She's still traveling right now. She's actually in Quartzsite, Arizona right now. They're traveling this week. And that's some of the best things I can do for any patient or any.
Yeah, absolutely. Absolutely. Yeah. Getting them back to that. I mean, it's crazy how pain, sometimes it's extreme, when we get injured, but when we don't fix it, I feel like it takes that time where, let's say 6 or 8 months go by and you start to kind of just get into like depression or, feeling weakness and like you said earlier, it's your body trying to like reheal itself, and it's exhausting, I mean, if you're not getting 8 hours of sleep, forget it, it's going to get only worse, your pain, so it's, I think all those things come into play. And, from what you're sharing, I mean, that's what chiropractic is about. It's about just helping people. I feel like,
I think a lot of people, they wait until they're in a lot of pain, but the people that seem to get the most benefit, they've been dealing with this nagging little pain for a long period of time. And that's just ongoing and ongoing. And that drains them day in, day out, day in, day out,
Yeah, 100%.
Yeah. The faster you get in for any type of care for your health, the better you're going to be off in the long run. So.
Yeah, absolutely. Yeah. The sooner, the better, for sure. How about throughout your career? I mean, what made you choose the location that you're at? And do you have any other locations?
Location really came down to, it was close to my house.
Okay.
My first job when I was graduating college, I was commuting from this area down to LA, and it was taking me 2 to 3 hours each way. This is our primary location for Gateway. I have some other offices in Irvine, Westminster area, but this is our primary location. Those offices are very similar, but we have other partners involved. They all do the same thing, but and one of them actually does some small surgical procedures. There's things we have that are out of our control, and then we have to involve other professionals and other help to get that person better.
Yeah, absolutely. And just a quick, I know you said stem cells earlier. Is that something that you guys offer in Mission Viejo?
We do. Yeah. So we do stem cells primarily for joints. We also do like hyaluronic acid for the knees. Some people like, osteoarthritis of the knee. We do PRP, which is platelet-rich plasma, which is great for even car accident. When you have a lot of scar tissue or some people have some pretty major injuries with these car accidents. Not always just the small injuries. Sometimes they're pretty bad. People come in very bruised up from the seat belts, and they have little micro tears in the traps. PRP is a fantastic option to heal that up.
How long does it take typically for someone to heal from a PRP injection?
So we usually will do a PRP and we won't reevaluate them for further PRP until about 6 weeks.
Okay.
It does take some time. During that time, we'll be doing some rehab with them, some chiropractic, whatever it might be. But the body takes time to, do something with that healing capability. And after about 6 weeks, we have a good understanding, are they done and they're healed? Or do we need to maybe do another one? Or is there something else that needs to be looked at? But most of the time, PRP is fantastic. And most people in one injection will heal up very well.
And then how about, I believe you said you had a decompression machine. Is that the famous DRX 9000?
You got it. That's one of them. So we have 3 different machines in our location here. One is the DRX 9000, which they would people say the gold standard for lumbar spine decompression. Mm-hmm. But it can be an aggressive machine for some people. So we have other options as well that work, I believe, just as well, but they're just, the comfort is different. Okay. So we have first the cervical spine or the neck, and we also have for the low back. And people with injuries, many times they have whiplash, and then we find out through MRI that they're having a herniation or a disc problem in the neck and or the low back. Decompression has been fantastic to heal that stuff up. And it's shown, even by the Harvard study, to have a 76% success rate, which is amazing.
Your decompression machine, is it the one that you have for like the cervical or the neck? And then there's one for the lower back too, I believe?
Yes, we have both the low lumbar spine and the cervical spine. The only thing you can't really truly decompress is the mid back area, because you got all the ribs there. It's a tougher area to treat. There's ways to do it, but it's a little harder.
I guess the other question too is that how does a patient or a client come about? Like, how do they choose, or do they need a recommendation to do decompression? Like, how does that work? Maybe not even somebody who's involved in a car accident, just any cash patient who wants to try decompression.
Like you said, unfortunately, in many instances, decompression is a cash option for people. It's covered by a select few things, but it's a cash option. But the adjunct care is usually covered through someone's insurance, whether it's the auto insurance or their medical insurance. Decompression by itself is great, but it's not the end all be all. There really is a process to healing. Like for us, over the years, we've developed what I refer to as our 4-step process. First, we kind of talked about is getting rid of scar tissue and getting the body into a healing phase. Mm-hmm. Then we need to get the mobility back. That's where the true chiropractic and stretching, range of motion, PT come in. Then once you have that motion back, you have to strengthen it back up so that it doesn't become injured again. So you have a strengthening aspect. For a personal injury case, that's kind of where they would be released once they hit that phase. The 4th phase for us is wellness care. So having somebody that's looking for lifetime wellness to come in, kind of like you go to the dentist every 3 or 6 months or whatever it might be. And we have some people that come in, once a month, once every couple of weeks, sometimes a couple of times a year, but some type of a wellness program to keep their health.
I guess looking back at your entire career, how long have you been a chiropractor for?
Basically the end of 2002. So just about 20 years.
20 years.
Flying by.
It does. It flies by so quickly.
It's been fun. It doesn't come without its challenges for sure, whether it's from changes from people's insurance, which everybody kind of knows about that stuff, to, what happened with COVID, where people were scared to come in and get treatment for a long period of time. So there's factors that affect it, but it's been a fun ride overall.
Any valuable, or what was, I guess, the most valuable lesson you've learned so far as a chiropractor?
In not just chiropractic, but in business, you have to evolve. You have to change. Not that you have to change your values or your treatment method, but everybody's going to be watching social media, right? They'll hear about the next best thing and this cures this. And so, you have to keep up on that stuff and understand it. And then when somebody comes and asks you about it, explain, is this a viable option? Is it, not enough research out there? How do you keep up with this changing world? Yeah. That's been probably the biggest lesson for me is, growing and changing. That's basically how our practice went from originally just the chiropractic to bringing in the medical and the physical therapy and all that, because each person has their own unique ability to help heal. And when you combine a team effort, it's amazing what you can accomplish.
Yeah, absolutely. Yeah, it's your team is extremely important, with your day-to-day operations. And so when someone wants to schedule an appointment with you, what is their turnaround time? Because I know there's some doctors that you go see or a chiropractor you go see, and usually they'll give you like a week or 2 weeks out. And so do you have available appointments almost on a daily basis, or do you set like a certain amount of time for those type of emergency appointments?
So if, somebody's in a car accident, they're in pain or severe injury, we really do try to get them in that day. There are some instances it's almost impossible, right? But in general, we can get them in that day or the next day. We strive for that because we know people that are in pain. One, if we don't get them in, they're going to go somewhere else, right? But two, we don't want them to stay in pain, and it's a process. When they come in, they're just going to take some time. It's not just they're coming in and they're going to be here for 10 or 15 minutes. Our first visit, unfortunately, it does take some time for that person. It's going to be a full hour to get through and really figure out what's going on. And then each treatment, it's not just in and out. They're spending time, 45 minutes to an hour in the facility going through a proper program to get them better. So we found that by doing that, it takes less time overall to get them better. And we find that they have a better long-term outcome.
So what made you become a chiropractor? Like what did you want to, accomplish? Was there something in maybe in your younger age? Was someone a medical doctor in your family or a chiropractor, or someone got injured? And like, how did you come about becoming, seeking this career?
Good question. So for myself, I went to USC for my undergrad, and I was pre-med. I was working locally. We have a hospital called Hoag Hospital. I worked there for about 4 years in surgery. I had an injury in college. I played sports at USC. I was redshirting during a practice. I came down, sprained my ankle very good. When I landed, I did something to my low back, and I had immediate shooting pain down the leg, and I was not able to physically get up. I'm 18-year-old, college athlete, and I was walking around with a crutch or a cane for 30 plus days. Went to the team doctors there, was getting Toradol injections, was getting steroid injections, was doing PT. And unfortunately for me, I wasn't getting anywhere. I came home during Christmas break, and one of my friends who I played basketball with said, "Hey, why don't you see this guy? He's a chiropractor." I knew nothing about chiropractic, but I was in pain. So I went there, and he took time with us. He took time talking to me, figuring out what was going on. I had, x-rays. I had MRIs already. They were at school, didn't have time to get them. He took some new x-rays at that time, and he went through, and instead of just talking about, a muscle and scar tissue and just that, he was talking about compression of a nerve. And he's like, "Well, I'm going to do this thing called an adjustment, and it's going to help to get that nerve pressure released." I'm like, go for it. I have no clue what's going to happen. He did the first adjustment. And for me, it was kind of like that wow moment. It wasn't instantly no pain, but it was significantly 50+% less pain instantly.
Wow.
I went to every day for 2 weeks on my Christmas break that year. And by the end of that, I was walking around, functioning again. Now, I'd already lost some strength. It wasn't a couple of months, but I was able to get back to it. So fast forward a few years after I graduated, I was applying to my med schools. I was working at Hoag, talking to all the doctors there. When I was there, the medical doctors that seemed really happy were the anesthesiologists. They were, they did their early morning. They didn't have to check up on patients all the time. But I wasn't into listening to music all day and reading a book all day. That's what they do most of the, when everything's going smooth, they have a pretty laid back job, unless it goes wrong. The surgeons I was talking to, the ones back in the 80s, were talking about how great it was back in the day and how hard it was right now that they have to get up and do these rounds. And they didn't know their patient from a number. I mean, I hate to say it, but they were really doing their job, but they're seeing patient after patient, surgery after surgery, and really didn't know anything about that person. I went back to that chiropractor that I had saw, and I sat down and talked to him for a while. He basically had a great relationship with his clientele, his patients. He had family time, and then he was running his own business. And that was something I did. I also did a minor in business when I was in my undergrad. And I really started thinking, like, that could be something different. I started looking into it a little bit more, and fairly quickly I decided, I'm going to do the chiropractic schooling when I graduated. Did that, and then opened my practice literally the first month after I graduated with my business partner we still have today.
Nice.
And going hard ever since. And I think that's kind of why we kind of geared towards a little bit more of the medical as well, like physical therapy and having medical here, is because I have that background and I know it's helpful, but I love having everything together.
Yeah. Yeah. And it seems like I guess, would you say it's fair to call him a mentor in a way?
Yeah.
Yeah. Right. So would you say like his success was probably the fact that he spent that extra time speaking to patients and connecting with them and giving them I guess you could say authenticity, by listening to them, like feeling, like, because that's the one thing that I, have an issue with when I go and see a doctor. It's like, especially an MD, they only see you for, maybe 5 minutes and they don't really explain everything to you. And the one thing I love about chiropractic is that, like you said, you spend time with the patient, you talk to them, you go into details about what's going on with their pain or their flexibility or moving, their leg up and down. That stuff is just, I feel like chiropractors are more, I guess, empathic, and I feel like they care more, even though maybe I shouldn't say that, but that's my opinion on it, which is probably why. Yeah.
Great take on it. I do think that it's neat to be able to teach a patient a lifestyle,
yes,
as well. And in our facility, it's not all closed door. It's very open, and we designed it on purpose that way because there's going to be patients that have bad days, and other patients, when they're here, they'll see that and they'll be like, I know that person, that not every day is going to be perfect. The majority of the people are coming in and they're excited because they're feeling better every single day. And that energy flows through the office, not just with our team, but the other patients out there. Now we have plenty of closed room. If there's something private we need to discuss, we have that ability, but in general, we like to keep it open because people love to interact. They really do. And when you see somebody making good progress or working really hard after a knee surgery or after a car accident, it helps that person to see it's okay for me to push, and I can get there and I can be that same person doing better. And that's pretty neat to see. So yeah, I agree that in the chiropractic world, it does take a little bit more one-on-one time to get to know that patient. That's kind of neat because over the years, I've made some amazing friends. A lot of these patients, once they leave, with their main care, we're out doing activities together. Now I'm an avid mountain biker. Nice. So I have a lot of patients that we now ride together almost every weekend.
That's cool.
Yeah. So that's been pretty fun.
I guess that was my next question. What type of hobbies do you have? It sounds like you ride bikes, right? Mountain bikes.
Yeah. I love mountain biking. I did CrossFit for many, many years. And, so that was a big aspect, but my kids now are getting a little bit older. I have 2 kids right now, 15 and 13. My daughter just finished a week-long soccer tournament. My son, does golf. A lot of my spare time that's what it is right now. And that's great because I enjoy it. And I know it's not going to be there forever. So
yeah,
right now and just, take every day as it comes.
Absolutely. Yeah. Yep. I'm on similar boats, a little bit younger. I have 2 kids, and it's like, I gotta set up that, daddy time so that they, cause like you said, we don't know how long we have until we can, spend time with them and stuff. And so it's important to give that time, to your family. So yeah.
And it's rewarding too. It's fun to
absolutely
changes. Man, it goes fast.
Yes, it really does. It really does. All right. Well, thank you so much, doctor, for your time. I really appreciate it. I guess what is the best way for a new patient or a client who has questions, or maybe an attorney's office? What is the best way to contact you? And what social media feed do you normally use?
The best way is going to be call the office directly. We have automatic text service. If we can't get to the phone, it'll send my front team a text so they can get in contact with you. It's 949-454-8811. If you want any information about our practice, grwc.net was our website. We have all kinds of stuff there, from exercises to book your appointment, all that good stuff. And if you're looking just to find some information, you can follow me on Dr. Victor Rafa on Instagram. That's my main thing that I kind of put some stuff out. I'm not a big person for the for that. But those are the easiest ways to get a hold of us.
Wonderful. Wonderful. I really appreciate your time again, doctor. And I will probably be seeing you soon at your office, because I do want to come by and do some recordings of your practice so we can use it for this video.
I look forward to seeing you. Have a great day, JPA.
Awesome. You too, man. Take care. Have a great day. Bye-bye.